Hello. A man came to my appointment. He is 44 years old, does not smoke, runs marathons, cholesterol is normal. But a week later he ends up in intensive care with a stroke. How is this possible? It turns out that all this time an invisible killer had been circulating in his blood, one that is not talked about in regular news. While he considered himself healthy, his blood vessels from the inside resembled worn-out brake hoses. Meet homocysteine. This is a toxic amino acid. Today I will tell you why it is more dangerous than cholesterol, how it steals your energy and memory, and I will name 10 clear signs by which you will understand whether it is time for you to get this test done, before it is too late. Watch until the end. I will give a step-by-step rescue plan. What is homocysteine really? In the 1990s and 2000s, science was flooded with studies linking homocysteine to the risk of heart attack, stroke, and thrombosis. For a long time, it was believed that it was the direct cause of disease. But science does not stand still. Today we know homocysteine is not just an enemy, it is a key indicator. It is like smoke. If you see smoke, it does not mean the smoke is to blame. It simply shows that a fire has started somewhere. It is a signal that there is a vitamin deficiency, hidden inflammation, or genetic disruptions in the body. How does it appear? We eat protein, meat, cottage cheese, eggs, and obtain the amino acid methionine. In the process of metabolism, it turns into homocysteine. Normally, this is only a short stop. The body should quickly convert it into useful glutathione, our main antioxidant, or recycle it back into methionine. For this, tools are needed. Vitamins B12, B6 and folic acid, B9. But if there are no tools, homocysteine accumulates and turns into a cytotoxic poison. It scratches the walls of blood vessels, the endothelium, makes the blood thick, and turns bad cholesterol into a deadly weapon. Scientific evidence. This is not just a theory. Look at the numbers. A large meta-analysis confirmed that an increase in homocysteine levels by 3 nanomoles per liter increases the risk of ischemic heart disease by 16%, deep vein thrombosis by 25%, and stroke risk by 24%. But that is not all. Modern neurology links it to Alzheimer's disease. It literally destroys neurons. Studies have proven that lowering homocysteine with B vitamins slows cortical brain atrophy by 7 times in areas responsible for memory. 10 signs it is time for the lab. How can you tell that this silent killer is already in your body? Here are 10 red flags. Chronic fatigue and brain fog. If you wake up already tired, if it is hard to concentrate, and your memory has started to fail. This may be a consequence of homocysteine neurotoxicity and B vitamin deficiency. The brain simply does not have enough resources for detoxification. High blood pressure at a young age. If you think that blood pressure rises only from salt or stress, look at the study results. Scientists found that high homocysteine literally switches off the ability of blood vessels to relax. It blocks the production of nitric oxide, the main gas that dilates our arteries. As a result, vessels become stiff, and the heart has to pump blood with double force just to push it through the body. Check your homocysteine level. It may be the culprit. Problems with pregnancy. This is painful to hear, but homocysteine is enemy number 1 for future mothers. It disrupts placental blood supply and can lead to microthrombosis. In women with hyperhomocysteinemia, the risk of recurrent early miscarriage is 2 to 3 times higher due to damage to chorionic vessels and impaired implantation of the embryo. If there were problems in your history, testing homocysteine and folate cycle mutations is mandatory. Numbness in the hands and feet. Do you feel pins and needles, tingling, or cold in your fingers? This is damage to the nerve sheath, which often goes hand in hand with high homocysteine. Early graying and pale skin. This is not just genetics. This is a marker that methylation processes are disrupted. The body spends all its resources fighting toxins, and there is nothing left for beauty, depression, and sharp mood swings. If you feel that the world has turned gray, Usual joys no longer please you, and antidepressants help poorly. Check homocysteine. The study confirms that high homocysteine correlates with depressive states because it blocks methylation processes, without which the brain simply cannot synthesize neurotransmitters, the happiness hormones, serotonin, dopamine, and norepinephrine. You are not lazy or sad. You may have a biochemical failure. Bone fragility, early osteoporosis. Usually osteoporosis is associated with women in menopause. But if you had fractures from minor trauma at 30-40 years old, or you notice that your posture has started to deteriorate, homocysteine may be the hidden culprit. High homocysteine levels disrupt the structure of collagen in bone tissue. Bones become not just demineralized, but fragile because their internal framework is damaged. The study noted that people with the highest homocysteine levels had nearly a twofold higher risk of hip fracture compared to people with low levels, regardless of bone density. Decreased vision and hearing. Our eyes and ears are permeated with the thinnest capillaries. Homocysteine makes them fragile. If vision has started to decline rapidly and the ophthalmologist sees no obvious cause, look at your biochemical blood test. The microvessels of the eyes and inner ear are the first to suffer from high homocysteine. A clinical trial involving more than 5,000 women showed that lowering homocysteine with a combination of B vitamins reduces the risk of age-related vision loss. Gastrointestinal problems. Leaky gut syndrome, gastritis. If you have been treating bloating, constipation, or gastritis for years, your homocysteine has almost certainly skyrocketed. B vitamins are simply not absorbed. The body does not receive the fuel to utilize homocysteine. This is a vicious circle. A sick gut, high homocysteine, damaged vessels, use of certain medications. You may lead a perfect lifestyle, but if you take pills for heartburn or diabetes, you are in a trap. These drugs steal the vitamins that should cleanse your blood of homocysteine. For example, a randomized study confirmed that long-term use of metformin increases the risk of B12 deficiency, which automatically leads to an increase in homocysteine. PPIs, omeprazole, pantoprazole, block B12 absorption. Oral contraceptives sharply reduce levels of folic acid, B9, and B6. The laboratory trap and genetics. Now the most important thing. On laboratory forms, the norm is often indicated as up to 15 nanomoles per liter. Formally, this is the reference range. But if we talk about a more comfortable level for blood vessels and the brain, many experts consider a target range of approximately 6 to 8 nanomoles per liter. That is, 15 is not yet a disease, but for prevention it is better to aim for the lower part of this range. It is also important to know that many of us have a genetic defect, due to which regular folic acid does not convert into the active form, and homocysteine levels rise. This genetic mutation can also be detected in the laboratory by testing the MTHFR gene. The test is often prescribed when planning pregnancy, with fertility problems, thrombosis, as well as for treatment adjustment, for example, chemotherapy. Rescue plan. What to do if homocysteine is elevated? The good news is that homocysteine is very well controllable. So what needs to be done? Step 1. Look for the cause. It is not enough to simply lower homocysteine. You need to understand why it is accumulating and direct treatment in that direction. Additionally, test vitamins B12 and B9, folates, in blood, TSH, to exclude hypothyroidism, creatinine, to exclude kidney pathology, genetic test for folate cycle polymorphisms, MTHFR gene. This is done once in a lifetime. If you have a defect there, regular over-the-counter vitamins simply do not work for you. Exclude gastrointestinal diseases. Step 2. Diet. We do not exclude protein, but we add an antidote to it. Greens, salads, spinach, broccoli, legumes. Reduce the thieves: coffee, more than 2 to 3 cups a day, alcohol, and smoking. They mercilessly deplete B vitamin stores. Step 3. Correct vitamin forms. Vitamins, but not just any. Often regular folic acid from the pharmacy does not work because 40% of people have an MTHFR gene mutation. Methylated forms are needed. Methylfolate, instead of folic acid, methylcobalamin. Instead of cyanocobalamin, pyridoxal 5-phosphate. Active B6, riboflavin 5-phosphate. Trimethylglycine, a powerful helper in lowering homocysteine. Omega-3. Dosages are selected by a doctor based on your tests. Excess folates are just as undesirable as deficiency. Step 4. Medication control. If you take metformin, oral contraceptives, or antacids for heartburn, know that they block the absorption of your rescuers. Discuss with your doctor the possibility of additional B vitamin supplementation alongside this therapy. Step 5. Monitoring. There is no need to take supplements for years. The first homocysteine check is 2 to 3 months after starting the program. If the level has dropped to 6 to 7, congratulations, you are out of the risk zone. Now it is enough to maintain it with nutrition and test once a year. Homocysteine is an indicator of how long and how well you will live. Taking this test once a year costs less than 1 tank of gasoline, but it can save your life. Health is not the absence of disease. It is knowledge of how to prevent it. Write in the comments whether you knew about this marker. Or maybe you have already tested it. What was the result? Let's discuss it. I will try to answer your questions. This was Dr. Helena. See you in the next video.